The National Drug Law Enforcement Agency has intercepted a container load of tramadol in Lagos.
The Nigerian Customs Service has destroyed smuggled tramadol valued at 168.3 million naira.
Over the past decade, while the world has been transfixed by the horrors of the opioid crisis tearing apart communities in North America, another opioid crisis, at least as serious, has been unfolding, almost unreported, across Africa. Tramadol is a synthetic opioid about 10 times weaker than morphine. It's commonly used by doctors to treat mild pain, with tens of millions of prescriptions written each year all over the world. But right across Africa, non-medical use of tramadol is exploding. In 2013, 300 kilos of illicit tramadol was seized across the continent. By 2017, that had rocketed to 3 tons. UN figures indicate that opioid seizures in Africa now actually account for 87% of the global total. But the situation with tramadol in Africa is far more complex than it first appears. The first thing we have to understand is who is using the drug and why.
If you look at the data, farmers, fishermen, and those in laborious activities dominated in terms of the consumption of this particular drug. A lot of this work involves a lot of staying up for long hours.
Moi, je consomme le tramadol. Je fais dans les puits d'eau, les fosses et les puisoirs. Il y a des zones où je pars à 20 mecs. Oh oui, c'est vraiment un travail risqué parce que bon, quand je prenais un comprimé de tramadol, je transpirais, je cravais, je ne ressentais pas la fatigue. Peut-être faut toujours bouger le corps. Je suis forcé peut-être à faire quelque chose. Je n'ai pas encore senti le désir d'arrêter. Et je me dis même peut-être que le jour où je serai dans un cercueil, j'aurai peut-être un comprimé dans une poche. C'est ma veste. Donc c'est un peu ça.
But while the majority of users are taking tramadol to help them cope with hard labor over long hours, it's also spilling over into youth culture, with people often mixing the pills with energy drinks, or more dangerously, with alcohol, to use as a party drug or aphrodisiac. And this is perhaps the source of the moral panic that seems to be sweeping across Africa around tramadol. When the Nigerian rapper Olamide mentioned the drug in his song Science Student, a reference to mixing up chemicals, it was immediately banned by the Nigerian National Broadcasting Commission.
J'ai un ami qui prenait vraiment. Bon, pour lui, il prenait juste pour se faire plaisir. Mais lui, bon, il a été au niveau où il arrivait à l'overdose.
So much tramadol has been used in Africa that there are now concerns that it's actually affecting local ecosystems. In 2013, a French Cameroonian team discovered tramadol present in the roots of the plant Nauclea latifolia, which is widely used in traditional African medicine. This sparked a wild round of speculation. Either a synthetic man-made chemical created in a lab happened by complete coincidence to also be naturally occurring in the roots of this plant, which would be almost unheard of in scientific history.
For me, it was a mental, let's say, revolution as a scientist. For me, there was no former experience or even in the literature of any kind of similar parallel.
Or it could mean that people in West Africa were taking so much tramadol that it was now seeping into the groundwater through their urine. Due to the vast scale of this issue, there were even theories that it must mean farmers were feeding tramadol to their cattle to help them cope with harsh conditions. Given the difficulty of gathering accurate data on drug use in Africa, the jury is still out. But one thing's for sure, this problem is serious and widespread. Many African countries seriously lack proper provision for drug treatment services. States like Cameroon are reported to only have one rehabilitation facility. Meanwhile, many African governments are scrambling to crack down on tramadol, most using the old war on drugs methods of repression and restriction. In 2017, Egypt formally lobbied the UN to place the drug under international controls, with the same restrictions as morphine and other medical opioids. These methods have failed to contain illicit drug use in pretty much every other context they've been tried. And West Africa already seems to offer a fairly clear lesson that this region will be no different.
In the case of Nigeria, what they did was ban the medication, introduce very punitive measurements. If they arrest you, you go to prison for more than 10 years and above. What we saw in Nigeria happening was that immediately the trade went underground, creating a huge black market. However, Nigeria sought to use a different method and they couldn't actually address the problem. What they did was to even magnify the problem. Ghana, over time, has adopted a very collaborative or coordinated approach in addressing a specific issue concerning drug consumption in its country. So what Ghana has done is to kind of look at the problem and see in what dimension could it be addressed, and probably propose activities to be able to address the challenges by doing a lot of education, engagement with the community members and all that. And what Ghana also did was to kind of review its law. So as we speak now, Ghana currently has a new narcotics law, which has sought to remove the aspect that sends people who use drugs to prison. So that is why, as advocates, we have always said that governments will need to begin to look at the drug policy holistically by approaching it from all angles as a development issue, as a health issue, as a human rights issue, and also, above all, we need to be humane in trying to address most of these challenges.
The main repressive strategy being deployed across Africa is to restrict the supply of medical tramadol so that it can't be diverted to the criminal market. But there are two major problems with this approach. The first is that the war on drugs already restricts the supply of medical morphine across the global south. So for millions of people in Africa, tramadol is the only option they have for actual pain relief.
Because when we did interviews with health workers, they admitted that tramadol was the most potent pain relieving medication for post-surgery and after pain medication for people who were probably cancer patients and all that. So if you ban this, it's going to be like morphine. How now it's difficult for pain management officers to be able to access morphine for their patients. And that is going to create a very serious toll on Africa, because that is one of the best pain relieving medication we have as a continent. And if we seek to ban or schedule tramadol, what is going to happen is that I think that you are indirectly criminalizing pain, because people will have to suffer with their pain without having access to tramadol to be able to address their pain. So if you ban it, Africa will bear the toll of the problem in terms of availability and accessibility of pain medicine.
But there's another, even more serious problem with trying to fight tramadol by restricting medical supply. And this is the big twist in the story of the African opioid crisis. Most of the tramadol doing the rounds on the streets of Lagos, Dakar, and Accra isn't actually tramadol at all.
There were reported cases of people collapsing, people going to seizures and all that. And that is not traditional reaction of tramadol consumption. Lo and behold, from the analysis, we saw that many of these were just substances that were probably put together by some of these labs coming from China, passing through to the region and trafficked into the country.
Ultra-cheap generic pills labeled tramadol are being produced in labs, largely in China and India, containing any number of synthetic opioids and other dangerous chemicals. They're then smuggled by the billion through West Africa's corrupt seaports and porous borders, creating an extraordinarily dangerous situation where people simply don't know what they're taking and can end up dying as a result. The problem here is that while drug enforcement strategies are aggressively pushed across Africa by the international community, medical fraud, which is really what's happening here, doesn't carry nearly the same political weight as an issue. And this is despite the fact that the World Health Organization estimates that fraud in anti-malarial drugs alone might cause up to 267,000 additional deaths in sub-Saharan Africa each year. Disturbing reports are also emerging of how the trade in so-called tramadol feeds into terrorism and local insurgencies.
I don't know exactly how many people I killed. I was asked to slit their throats like sheep. I cut the throats of more than 20 of them. That's why I deserted.
Ibrahim says he was taking tramadol, a powerful painkiller, and the jihadist drug of choice.
We were under the influence of drugs, which we took as medication, and we were also given injections. Sometimes they made us drink date juice, but we quickly realized that it was not date juice because we were possessed afterwards.
The link between tramadol usage among terrorist groups in West Africa has been an interesting conversation lately. What was happening in the case of Boko Haram was that a lot of these young ladies and gentlemen are fed with tramadol. And so that is why a lot of them were able to do those kind of atrocities.
West Africa stands at a crossroads in dealing with its opioid crisis. It can try to crack down, following the same war on drugs policies that have failed in the US and in so many other places across the world. Or, just maybe, West African governments might examine the evidence, learn from the mistakes made in the West, and end up leading the way to a more rational, effective, and humane approach.
We'd like to congratulate drugs for winning the war on drugs.